Hi, my name is Julie Dunstead, and I'm going to explain to you the evidence behind using Benazepril in the treatment of chronic renal failure in cats. Renal failure is a disease that is commonly experienced by cats and dogs. It is typically characterized by a reduction in the glomerular filtration rate and a reduction in the functional mass of the kidney. This then leads to activation of the RAS pathway. In the RAS pathway, there is renin, which is released by the kidney. This then acts on angiotensinogen, which is released by the liver to make angiotensin 1. Angiotensin 1, under the influence of angiotensin-converting enzyme, makes angiotensin 2. Angiotensin 2 has various effects around the body. Some of these include its actions on the adrenal cortex. Here it stimulates the release of aldosterone, which acts to cause sodium and water reabsorption in order to increase blood volume. It also causes vasoconstriction of arterioles in order to increase blood pressure. Now, Benazepril, also known as Forticor, is a drug that belongs to the class of ACE inhibitors. As such, it acts on the ACE enzyme in order to reduce the amount of circulating angiotensin 2 in order to reduce its effects, as I mentioned before. Typically, it is administered orally as a prodrug and is metabolized in the liver to benazeprilat, which is a selective inhibitor of the ACE enzyme. In cats with renal disease, it is given at a dose of 0.5 to 1 mg per kg a day. Lastly, it undergoes biliary or renal excretion, making it a relatively safe drug to use since it does not accumulate in the body. However, caution should be exercised if it's used with other hypotensive or diuretic drugs. Benazepril tends to be associated as one of the main drugs when treating congestive heart failure. However, new studies have shown that it has good efficacy when treating chronic renal failure. In one study, 61 cats were enrolled in a prospective, randomized, double-blind, placebo-controlled clinical trial, where cats diagnosed with CRF received either placebo or benazepril once daily for 6 months. After treatment, the cats on benazepril showed a reduction in their urine protein creatinine ratios compared to the placebo, who actually experienced an increase in these values. However, in this study, blood pressure was not measured, but the researchers still came to the conclusion, using their efficacy assessment requirements, that benazepril showed a result of good efficacy compared to the placebo. In another clinical trial published in the Journal of Veterinary Pharmacology and Therapeutics, researchers took 20 control cats and 32 cats with experimentally induced renal insufficiency. This study found that compared to the control, cats that had the treatment had a significantly lower systolic and diastolic blood pressure, circulating ACE levels, and had an increased glomerular filtration rate. These findings were similar to another study published in the Journal of Veterinary Medical Science that measured the response to benazepril in renal failure-induced cats as well as cats with spontaneous renal failure. This study also showed a reduction in urine protein creatinine ratios and systemic blood pressure. All values also increased back to the pre-treatment levels when the drug was removed. The researchers came to the same conclusion that benazepril is an effective treatment for cats with chronic renal failure. With all of this gathered evidence, I believe that benazepril should be recommended in cats with chronic renal failure, especially in patients that are experiencing proteinuria. It has a moderate positive effect on systemic hypertension, but more research should be done in this area to confirm the benefits, because each of the mentioned studies had their own limitations to their published results. I don't believe that any strong conclusions should be made about the use of benazepril and its ability to prolong survival time. However, it should be noted that it can delay the progression of the disease. Thank you.